Hi, this is my Nursing 406 leadership interview. Thank you.
Tell me about yourself and why you feel you are qualified for this management position.
My name is Kimberly McPherson, and I have been a nurse for 9 years. My nursing career began at Southeastern Community College, where I earned my ADN. From there, I went to a staff nurse in the emergency department at Southeastern Regional. I went through a vigorous education process there to gain the skills needed in the emergency room. Upon that, I had worked several small other jobs, being at Columbus Regional, and so I could be closer to home. And then I went back to Southeastern to gain a more leadership role. I became a charge nurse there over that busy ER, and then I gained more skills, which led me to promotion of a clinical supervisor over that ER. That gave me the skills of really being a leader, doing staffing, looking at acuity, triaging, and helping with, communication to the staff, doing evaluations for the staff, and being a team member throughout the hospital as a representative of the ER there. After that, gaining those skills, again, I wanted to be closer to home, so I reached out to Columbus Regional and applied for the nursing supervisor job, in which I was given. I've been there for the last 5 years, and during this time I have definitely gained a lot of leadership qualities. It is my responsibility when I am there to look at staffing throughout the house, look at acuity levels, making sure our staffing patterns meet the acuity levels, downsizing when need be, looking at the budget, looking at overtime, anything dealing with any kind of problems throughout the house. We are the person that everybody goes to. I access medical records. I speak with other, facilities of care. I help give instructions. I'm an active member of the RAT team. I'm an active member of the CODE team. I am a BLS instructor there, and I help with any education that I have the opportunity to do so. Professionally, I am now trying to strive to gain even more leadership skills and to advance my career. I'm currently at UNCW pursuing my BSN, and my goal is to later get my MSN in nursing. Personally, again, I have been married 11 years to Jack, and we have 3 children that I'm very proud of, and I'm very active in their lives. They keep me going. I feel like I have 5 full-time jobs instead of just 2. Meaning my family life and my work life. I think my job choices, come into play as far as my family life. I feel that I would be a good leader for you guys because I do have the experience of a leader, and I do know how to lead staff, and I do know how to motivate staff, even when the chips are down and you're short staffed, to get things done. I think with my vast experience and in different places, and to see how different things, it's given me different tools in my toolbox to where I would be a definite plus to your team.
What is your style of leadership?
Well, as I said, I'm currently at UNCW, and I have been taking a leadership course, and through this course we have been evaluating ourselves and what type of leaderships we like or we are more prone to do. We actually did a questionnaire where we looked and see if we were more authoritarian or whether we were more laissez-faire or whether we were more democratic, and which one we actually valued more or leaned to more. I actually scored high in the authoritarian and in the democratic, with the democratic being the highest and the laissez-faire was the lowest. I tend to feel that I'm more democratic in leadership style. I tend to think that I like to look at everybody as a team member, whether it's just a unit base or whether it's, through the whole facility. I feel that a team is only as strong as its weakest link, and it is a leader's duty to be part of that team and to be an active player in that team and to lead by example. I think that if they're actively, involved in what's going on, that your team members are more apt to do a better job. They feel like they can approach you better, which can help, pinpoint problems. They may have a suggestion to help solve a problem that you might have not have thought of. I think that gives them more respect in their eyes. It also builds their confidence in their skill level and in themselves, which in turn will cause them to want to be a part of your team, which will help with retention, which is something that a lot of nursing facilities have issues with. I think with being a democratic style helps with these. It's more of a team builder thing. I think that is why I tend to lead to that style, even though I did score high in authority, and I think that is when those characteristics come out, when I feel like there is a need to lead the way without question, when there is a direct course of action that you need to take. But mostly that's the one that I tend to go with, is the democratic style of leadership.
What style do you prefer your supervisors to display, and why?
Well, as we've just discussed, I tend to like someone with a democratic style. I don't want somebody in an authoritative style that's always over my shoulder and on my back, and that I feel like I have to always look over my shoulder, that I'm not doing things correctly. I think with a democratic style, it gives you just enough room to let you spread your wings and fly and build the confidence in your own style of leadership and your own practice. And I think that's why it's important for my leader to have that. I want to be able to grow. I don't want to be on a plateau and not feel like I can do anything on my own. And I think that's why that style tends to, if I have a leader that has that type of style, I tend to do better with.
Describe the core values that are most important to you and why.
Well, again, I've learned to evaluate myself through this class that I'm in currently, and core values play a very important role in who you are and your character and your professionalism. When I looked, actually review those, and there's several that I do tend to have characteristics with, but when I go through and mark them off, I think the two main big players that I can't never mark off my list is integrity and family. Looking at integrity, I think it's important to understand what integrity is. That's doing the right thing even when nobody's looking. In the nursing profession, that's a very big characteristic, or a very big value that I wish that all nurses have. We deal with people's lives, and I think you've got to be able to make the right decision all the time. But even if you don't make the right decision, you need to make the right decision to report that you didn't make the right decision. Integrity plays a big role as far as earning respect amongst each other, earning respect for each person's clinical practice, and on a nursing unit, you need that. Throughout the hospital, interdisciplinary team members also need to know that you have integrity, that when you tell them that they're you're taking this patient down, that you told them everything they need to know, that they can trust in you, that your care has been given appropriately, and that you're turning them over and not setting them up for failure. I think that's one of the reasons why integrity is so important. The second core value I mentioned was family. My personal family is definitely a big role in my life. I want to be there for my kids and for my husband, for my parents, and my mother-in-law and father-in-law. I think, they play a big role in my family, in my life. If I'm not at work, I'm with them. I feel guilty when I'm not with them. Don't like to take time for myself. I'd rather spend it with them. Again, family's a two-way street. I looked as my work, my staff members as a family, my work family. We're there just as much with them as we are with our regular families a lot of times. And it's important to build that family unit and that trust. And, with that family unit, you get caring and respect and everything. It kind of encompasses all the other core values that I tend to, value. That's why I chose that, and I think it's important to have that on your team, and I think it's important to have it on your unit so that everybody's more cohesive and respectful of one another, and even in turn be more professional. And I think if you care for one another, even if it's nothing more than professional, then you'll have a much more smoother running team in which you can get things accomplished in a much timely manner and a manner that's more productive to the staff and to the patients. So those are my two core values that I feel is important.
Give an example of a model of care that you believe is effective in delivering high quality, fiscally responsible care.
Well, today's health care reform has put a lot of constraints upon how we operate things now. You see a lot of facilities that's having to downsize and to reorganize, and I think that the modern style of the modern style of care or model will actually be more beneficial to the way the healthcare reform has put these constringent, ties on healthcare. I think as the way it's explained is that you work together as an interdisciplinary team. You share resources. I think you're more fiscally aware of what do you really need to use and what do you really need to have to run your unit successfully based on your patient acuity and your staffing patterns, looking at overtime, looking at how staff can be shared amongst one another. So I think that would be a wise model of care to use. I think you can work together again as a family unit throughout the house to make sure that those things are being met. I think that will also affect the physical component of that. I feel that it just encompasses everything that healthcare reform is causing these changes to be, and I think that's why it would be more productive to have that type of model of care.
List 3 skills you feel are most important for your managers to use when leading an interdisciplinary team.
Well, when you're working with several different groups of people, the first thing that comes to mind is communication. Communication is very important in any role that you do. You have to have good oral skills and good written skills. We use emails. You got to have good etiquette. You have to be clear and concise. Without clarity, you're unable, your team members might not know exactly what you're looking for as far as their role in, that day or in that procedure. I feel staff needs a clear, concise understanding of what you expect of them in their duties on a unit. They can't perform well if you don't give them clear direction to be able to perform well. Without the clarity, if talking with the different teams, they won't know what role and where their role comes into play on your unit. And also that's orally. Even in written forms, it's you got to make sure you have the right communication to make sure the right job is getting done at the right time. So I definitely feel that is very important. I think we should also be respectful of one another. I think the respect amongst each team member and each interdisciplinary team for what their role is important. We're there for one common cause, is to work together for a positive patient outcome, to be more beneficial to the patient. I think we need to respect that, the housekeeper's role is just as important as the nurse's role. And just like the doctor should respect that the nurse's role is just as important as their role. I think with the mutual respect throughout the different teams and interdisciplinary teams, it can build you a more cohesive and stronger unit, which again will affect the patient care and your retention, of your staff. I feel that's even through your manager to your staff, you need to have that respect there where they feel that they can come to you with anything and be able to discuss it, and you're not going to belittle them or talk down to them, but you're going to help see them through whatever problem there may be. That comes to my third thing, is empathy. I think as a leader, you should have empathy towards your staff. and interdisciplinary teams, with their roles, different roles equals different responsibilities. You can't you have to manage people up. You can't manage people down. I think that builds a more cohesive, unit as well. I think that it puts a better perspective in the patient's eyes if you can, understand what that role is, what that team member's role is, walk a mile in their shoes, so to speak. I think with that understanding, again, it comes all together, which brings you to a more cohesive state of being and allows you to work better together and a more harmonious, way of working together, where again, the perspective of the staff and the perspective of the patient will be that one of unity. And that's why I feel those three things are important in a leader to be able to express and use, especially in their interactions in a disciplinary team.
To what extent do you possess these skills?
Well, I've always been a good talker. My mama says I've never met a stranger, and I've always tried to give the instruction in a leadership role to what I feel I would need if I was in the other person's shoes. I think that's where, the empathy comes into play. If I'm new to a job and I'm not sure what you expect, I feel that my leader, which is me in this role, should be clear and concise. I would give those clear communications. I would ask, for you to return, what did you understand, what didn't you understand, and make sure you understood before I let you, go on your own to do something. I would, I feel that I respect others well. I want to treat others the way I'm treated. I don't feel that I'm entitled into any other respect than you are. I feel that even though I may have a role of leadership, my job is no more important than your job. It's just my job is to strengthen you and yours and help you grow. So I feel like because of my background and my different, years of being in this type of position, that I have very strong communication skills. I feel that I'm very respectful of my staff, and I feel I can be empathetic towards my staff, and I've proven that through my roles. My evaluations speak highly of these different things. So I do have, some communication back to me that I am strong in these different areas.
What management skills are you lacking?
The only thing I can think of that I've not had as much experience as other things is budget planning. In my current role, that's not something we have an actual budget that we sit down and fill out ourselves. It's something we work with our immediate manager and supervisor as far as, what our needs and meeting the goals. We do we play an integral role with the budget planning as far as looking at overtime and cutting overtime by using different staffing patterns, etc. But to actually sit down and to write out a budget, I've not had the privilege of doing that. I do know that is one of my weaknesses. I have had business planning in the past. I've actually taken classes in it. I don't think that it's not something that I can accomplish without, proper, guidance through that. And so I think that's my weakest part as right now in a leadership skill.
What is your plan for developing these skills?
My plan to develop these skills would be to seek more guidance. I would probably pair up with another manager that's been in that role to kind of see how your facility goes about budget planning. If it's through a year-long process where you do so much every quarter, or whether you kind of plan out for a whole fiscal year at the beginning of prior to the beginning of that fiscal year, and how your spending and budget planning would be. If I still felt that I lacked in my knowledge, I would seek out other classes that would help strengthen me in that. I think it's important to grow in this area, especially with wanting to take on this management position. I would look for other leadership, classes that would be budget planning focused. Again, I would look, and I would also seek out a mentor in that department.
In what ways are planning and budgeting related?
Well, again, you got to be able to plan well to be able to budget well. I think they kind of go hand in hand. You need to be able to look at what has been a trending pattern when you're looking at your fiscal year, seeing what your expenditures are, what you can save on, whether it be staffing, whether it be your different types of materials needed to run your unit, whether it's some kind of new technology that's come out that would be beneficial to your unit and to your patients. It's important to plan those out, financially stably. You got to make sure you got enough income, budget planning, to be able to spend the outcome and not be in the negative. So I think they go hand in hand. You got to have a strong planning background by being able to look at trends and what's been, the going thing or what's happened in the past. And you've also got to plan as far as what costs are now, what they're trending to become, or what they may be. You got to be able to plan, what your income sources will be as far as if it's, Medicaid, whether it's private pay, if any of that influx, if you're looking at an outpatient versus an inpatient status, observation status, the payment reimbursement as far as that. You got to be able to, have all that planning ahead to be able to figure out what your budget will be. So I think they kind of go hand in hand. One without the other you wouldn't be successful in either one.
What factors would you consider when planning and budgeting?
Well, the first thing I would look at is I would take a retrospect look at the previous year. I would look at the days of patients, the number of patients per days. I would look at the staffing patterns needed for those number of patients per day. I would see what the FTEs would be needed to run my unit based on the amount of beds available. How many days we had the beds full. I would look to see if we needed, our RN ratio to a LPN ratio to a BSN ratio. I would look at how many NAs we would need to take care of our patients. I would look at, JCAHO and different nursing organizations' suggestions for appropriate staffing patterns to acuity. I would tend to, see what the trending patterns for census was throughout the last fiscal year to help plan a budget. I would take note of the different supplies used on my med cart, so to speak, and how much is used based on the different types of patients. I would also plan to see if there's any other sources that we could, look for different supplies at a better cost. I will look at a better management of time versus need. So those were some of the things I will look and plan in my budget. I think it's important to look at each one and how they would affect the ebb and flow of the money sources coming in. I would make sure, if big needs were coming up, to plan appropriate for that so it wouldn't take away from my other budget needs. It's definitely important to make sure our staff gets paid, so I would, make sure they would probably come first. And any technology needs or advances that is required of us, I would make sure that was budgeted in as well as needed. So those are some of the things I would look at as far as planning a budget. I would, prioritize what is needed now, what we can kind of do without, and what my wish list would be. And hopefully through, the economy and the reimbursement, I would be able to do the ones I definitely need and the ones that would help us out, and my wish list, so to speak, to be on the back burner. But hopefully be able to work towards those by better managerial choices that would allow those to be part of the budget. That would be what I would look at.
Let's assume you are hired into this position and the budget process has already been completed by the previous manager. You notice that the budget does not include enough money to cover staffing expenses for 3 months of the fiscal year. What steps would you take?
Again, looking at the budget, I would first review the budget again to make sure I didn't miscalculate anything. You know, we are human, we do make errors. If I had a mentor at that point, I would ask him to review it with me again to make sure I didn't make any, mistakes in doing my calculations. At that point, I would, if those still pans out to the same thing, that we're short on, the money for staffing, that's definitely a problem that needs to be addressed. I would look at what the other things that the budget has been planned out for. Again, I would prioritize. First, foremost, I would see what we definitely would need. If it's some kind of new equipment that is a definite need, I would put that to the side. If it's stuff that we would just want to upgrade or think we need, I would definitely put that on the back burner. I would turn that money, look to turn that money back into my staffing, because without staffing and appropriate staffing, we don't have a unit. At that point, I would go to the VP of Finance. If we have a finance officer, I would ask them to please, look at the budget with me and let's review it. I would also, ask them for an extension of time to see if we can better financially plan the budget for the fiscal year by looking at prior trending. I would already have the different suggestions written down to discuss with them to see if they feel those will be financially sound and be something that we could actually do as far as changing the budget. But I would definitely ask for a time extension to better review the budget, to better plan the budget, to make sure that the staffing would be paid. Because again, if we don't have staffing, we don't have a unit. It's very important that our staff feel that they're there and they're appreciated for the job that they do. So I guess my steps in a nutshell would be to review it, to see where the problem is, to go to my mentor to see if they have any suggestions, to go to my VP, ask for extension, and to give them my suggestions and see if we could go ahead in a timely manner solve the budget problem, or whether I would truly need the extension to better fine-tune the budget to where it would be successful in paying our staff. That is what I would do.
How would you describe your level of emotional intelligence?
My emotional intelligence, I think I'm pretty involved with my staffing. Now, I tend to know everybody not only by face but by name. It has taken me a year or so when I first began to get used to the different faces, and as we gain new faces and lose faces, I still have a learning process. I think because of my emotional intelligence, that's allowed me to be able to read a person well, to see what their strengths and weaknesses are. It's enabled me to build better relationships with my staff and with the different teams that I'm involved in. I think so. I think I'm pretty well versed, as a lack of a better way of putting it, in the emotional intelligence and reading people and setting the appropriate tone for the appropriate discussion. I try to be mindful of that. Again, I've always used a rule of thumb. I treat others the way I wish to be treated. I feel everybody, deserves that same type of respect. And through those teaching and leadership skills and the development of those professional skills, it's allowed me to be more inept and adaptive to the emotional intelligence in my role.
Give 2 examples of how your emotional intelligence have positively impacted a group or team.
Well, on a day-to-day basis, you never know what staffing patterns is going to be at the hospital. Through call-outs and call-ins or, different things in acuity. I've actually had a couple of times where we've been short on staff. Can't get anybody to come in, and as we all know, that can be frustrating, especially when we have a full load. But luckily, I've been able to go around and be able to talk to my staff members and pull them together as a team and say, let's do this as a team effort. We're here to take care of our patients, and we can all do together. And really, I've tried to motivate them and be their cheerleader as those nights sometimes have been our most successful nights of everybody pulling together and getting the job done, and even to the point that no breaks were missed, people were able to get their lunches on time. So I think me being a good motivator and a good positive impactor, that even when the chips are down and all is despair, I've been able to move them emotionally in a right frame of mind that they can do it, and not only do it, but do it well. So I think that's been one example there. I think because of my emotional intelligence as well, another positive thing that I've done is because I do work as a BLS instructor. It's given that group that's never had any kind of CPR class, and they come in, they're afraid. Being able to read them and see what their learning style is, and being able to set the tone that's a positive tone in a learning environment, that they've been able to come in and to be at ease, to learn the skills needed to be able to perform CPR the correct way, to give them the confidence in themselves to where they can perform the skills needed for CPR, and to put them in a mood that they're relaxed enough to recall the information to pass the test. I've been told that I've been a good instructor in that way of putting people at ease, and I think through the skills I've gained through emotional intelligence and being able to set the mood and the tone and create an environment where people feel they are comfortable and able to learn, that it's caused my people to be able to pass my class without any problems or issues. So those are my two examples as far as using emotional intelligence: motivation for my team when the chips have been down, and setting an environment that's conducive to learning and getting people to be successful in what they're trying to do.
Is there anything else you feel would be important for me to know about your qualifications to lead and merge the Med-Surg units?
As far as me and a leader, again, let me stress, I feel my team is only as strong as the weakest link. Of course, I don't want to be the weakest link. I'm a go-getter. I've always been someone that strived to do better and to build better and to be more professional. I've always wanted, my leader to be someone that earns my respect, and I feel through doing a team effort and approach and being a good motivator and a clear communicator, that person can be a good leader. I feel I have those qualifications. I feel through my experience of working in one of the most busiest ERs and be able to quick think, to quick judge, to quick triage, to quick assess, whichever way you want to put it, has enabled my skills to grow in that area to where I can assess the situation and feel, how to either diffuse it or to motivate it as needed. I think that's important, especially if you're, talking about merging different units. You've got a lot of different personalities to bring together. I've actually had experience in helping do that. At my current job, we've actually merged 2 floors. We've actually merged 2 floors on 2 different levels. We've put our telemetry Med-Surg together on one unit, and we've actually put our family birthing center and our pediatric and Med-Surg overflow as one unit. So it's 2 separate units now, and it used to be 4 units. We've been heavily involved as far as a nursing supervisor to be able to do that. It definitely takes motivation. It definitely takes a positive team image, a positive team player to do that, because, used to this floor does that, this floor does this, now we're all together in one team. I don't have a problem pulling any nurse from any area to work in any other area now. I think those are strong skill sets as far as being an example of that, to showing them and giving them the confidence in that. Another thing about me is I am a go-getter as far as I don't believe in calling in. Through my career, I've had very few absences. This past 5 years of me being a nursing supervisor, I've only called in 2 times. I think that dependency and knowing that you can count on me is very important. The 2 times I called in, I was getting ready to go into labor, and the other time was when my daughter was hemorrhaging post-operatively. Again, both of those were triageable as being priorities, and I feel that if I commit to something, then I'm going to commit to it. I'm not going to do a half job, I'm going to do a full job. I feel it's important to have those skills in a leadership position. I feel it's important for, to lead by example. If I, call out, then why shouldn't they call out? Again, that causes disharmony through a team. I think, if you've got issues with that, it's definitely important to go ahead and communicate with that person one-on-one to see what's going on and try to fix it. Those are skills that I have. I have, the thrive to want to have more knowledge. I think in a leadership role, it's definitely important to always want to improve yourself, knowledge-based, skill-based, clinical-based, and that's something I always strive to do. I feel it's important for me to do that, because if you're learning new things, and we've got new nurses coming out and they've learned new things, I need to be what's on the up and up. I think it's important to follow policy and protocol. I feel it's important to know what the new standards are and to make sure that my team is following those standards. My patients come first. I feel like my patients are my family members as well. I think they should be treated just as if you want your own family member to be treated. I think these skills are all needed as far as running any unit, whether it be your units or whether it be any unit per se. I truly feel I would be an asset to your team because I possess these skills. I possess the strive to do better, to want to do better, to strengthen my team, to be a team player, and to be a leader that you can be proud of, and to make not only my unit successful, but the whole facility successful. So that's just a little more about myself that I feel you could take in consideration for this position. And that's all I have. Thank you.